Germany continues to ease its lockdown with shops reopening. A step forwards or backwards?
More than 70 million people in Germany haven't had the virus. That means we have to keep up the hygienic or general protective measures to prevent a second wave. We shouldn't become careless, especially when it comes to the first easing of lockdown measures. It shouldn't cause a landslide of easing.
So as Germany opens its doors again, it needs to be careful not to open the floodgates. Welcome to our COVID-19 special here on DW News. I'm Monica Jones in Berlin. Good to have you with us. Now, we all want things to get back to normal and we all want to stay healthy, but it's a thin line between risk and reason. Now, luckily, we have scientists to point us in the right direction. I'm joined now by Tobias Kurt. He's a professor of public health and epidemiology at the Charité in Berlin. Good to have you with us. So please tell me, how do we get out of the lockdown without risking a second wave of infections?
Well, that's the key question right now. Many are discussing it, obviously. I think if we look at the extreme options that we have, which is to keep the lockdown going for another 2 years or to open up everything right away, a middle way may be best. We have to be very careful with the things that we have achieved in Germany, particularly. We're doing pretty well, and the healthcare system was luckily not as affected as we were afraid of. So we have to open very carefully and look at several parameters to see how this careful opening up is affecting the new infection rate as well as the consequences of these new infections.
Well, let's talk about these parameters, because a lot of the measures obviously are based on scientific models, and those models again are based on data, and that changes constantly. How reliable are these models then?
Well, these models are based on data, that's correct, but they're also based on many assumptions. And these assumptions are theoretical, and they do or do not take several aspects into account, such as the behavior of the population, for example. Often these models really addressing the viewpoint of the virus, so to say, but not so much the viewpoint of the population. So I hope that we see more models in the future that also account for psychological, social, economic aspects of these infections, and that together these models will point us to a better way how to slowly and progressively we can open up and find a so-called normal life after COVID-19.
All right. I like this, the viewpoint of the virus, and perhaps what we'll be talking about in just a moment is going exactly in that direction, because there's a lot of talk about lowering the reproduction number R. I'll talk to you about that in a bit. But first, let's take a look at this video.
For a disease to spread, the first person who gets infected, patient 0, has to infect at least one other person. If that doesn't happen, the disease cannot spread. But if patient 0 infects more than one person, and those people also infect more than one person, then the number of people infected rises exponentially, and we have an epidemic on our hands. The average number of people that patient 0 infects is called the basic reproduction number, or R0. It helps scientists estimate how a disease will spread and whether measures need to be taken to contain a potential epidemic. R0 comprises several factors. First, the progression of a disease. The longer you are infectious, the longer you can infect other people. Makes sense. Add to that the number of people with whom you have direct contact, and the likelihood that the disease will be transmitted. Now, that's different for each pathogen. With measles, for example, it's enough to be in the same room as a person who's infected. With HIV, it takes direct contact with bodily fluids to get infected. When you combine the three factors, you get a rate for R0. If R0 is greater than 1, it indicates the potential for an epidemic. But it's important to understand that R0 is a hypothetical average. Its calculation relies on the assumption that there is no immunity in the community, there is no vaccination, and no containment measures in place. So R0 is relevant in the initial phase of a disease outbreak. Once you have an epidemic, scientists stop talking about R0 and focus on R. R is what is known as the effective reproduction number. It describes the transmissibility at an advanced stage of an epidemic, when a part of the population has become immune. The more people are immune, the smaller R gets. Generally, people who have developed immunity to a new disease can no longer get it, and in many cases, they are no longer infectious either. Containment measures, such as quarantine, can reduce R as well, because they reduce the overall number of contacts between people. The aim is to get R below 1. That's when, on average, infected people pass the disease to less than one other person. Only then does the number of infected people go down overall and the disease can be brought under control.
Professor Kurt, that was quite a lot of information. What is the key takeaway that we should understand about the reproduction number R?
Well, I think the report made it very clear that a lot of assumptions go into this estimation. The basic information is very simple. It's the average number of susceptible people that someone with the infection will infect in the future or with the disease. Important is also how many days before you actually have symptoms can you spread the virus. And so this number really tells us something about how many will be affected and if the spread of the disease will be exponential or not. But this is only one measure, and I think we have to really understand that this measure has to be viewed with other information, such as healthcare systems, such as factors that affect the population itself. But I think the report made it very clear that these numbers are important for an infectious disease. These are classical numbers for infectious disease epidemiology, and we use them every day, and we learn a lot about these models, but they're very complex and detailed if you try to calculate it.
Right. You already said that there's a lot of various aspects going into it, and there's certainly a mathematical model now from British epidemiologist Neil Ferguson that aims to spread the virus over several waves, so to speak. It's called the hammer and the dance strategy, and it involves strict measures to reduce infection numbers, followed by the easing of a lockdown. Now, were the numbers to rise again, there would be a second lockdown. The numbers would peak again and again, periodically. Now, the advantage is that the health system would not be overburdened and a growing number of people would develop immunity. The disadvantage, it would take months, if not years, to beat the virus. Professor Kurt, is there any shorter way?
Well, the shortest way would be if we have an effective vaccination, obviously, that we can give to everybody, but that will be a month before we have this vaccination available. These models, the hammer and a dance model, for example, are theoretical models that certainly work well, let's say, in the laboratory setting. One thing that these models do not so much take into account is if it is actually practically doable. So will the population accept that they can dance, which means you can go out, you can live a normal life, and then eventually if the numbers go up, such as the basic reproduction number, then we go back into lockdown. Now, having lived through lockdown now 3-4 weeks, everyone knows how difficult this is, and people really go insane. It's almost impossible to keep this going without any hope that we can release some of these measures and start to have a normal life, not even to speak of the economic and psychological consequences that in addition kick in here. So these models need to take into account other aspects too, and they need to be practical.
All right. Tobias Kurt, Professor of Public Health and Epidemiology at the Charité in Berlin. Thank you so much for your time.
My pleasure.
And now it's time for your questions on the coronavirus. Here's our science editor, Derek Williams.
Shouldn't countries come up with a common strategy for fighting COVID-19 and preventing future pandemics?
We already have an organization that's supposed to develop common strategies for preventing pandemics. That's the WHO. Its primary role is to direct international health within the United Nations system. You know, COVID-19 has really highlighted shortfalls when it comes to an organized international response. I don't think anyone at this point would argue that a common global strategy for pandemic situations is more vital today than ever before. But whether eventually we get one when COVID-19 has settled is another question. I would certainly hope so.
Is a person who's asymptomatic for COVID-19 immune to the virus?
There's a big difference between being asymptomatic to a disease and being immune to it. Now, when you're asymptomatic for an infection, you have it, but for reasons involving your own immune response, you don't develop the physical symptoms of that infection. What's dangerous is that those asymptomatic carriers of the disease are likely spreading it to others, and that's fueling the pandemic, even though they show no signs of the sickness themselves. Being immune to a disease is different. Immunity comes after you've been exposed to the bug and recovered from it, and your immune system has been trained to recognize and quickly destroy the pathogen when it meets it again. So immune people help break the chain of transmission because, at least in theory, they can't be reinfected and turned into virus factories. Asymptomatic people, on the other hand, do give the virus to others, and that's the key difference.
Now, that was our COVID-19 special. Finally, though, we leave you with a special birthday celebration, Corona style. American war veterans in Sachs has turned 105, but the party was cancelled due to the pandemic. Instead, veterans, police officers, firefighters and a local car club drove by his home in Los Angeles in honor, adhering to social distancing rules, of course. Now, Sam's birthday wish was to receive 105 American flags, one for each year of his life. He ended up getting over 400, along with thousands of birthday cards.